the journal, as George indicated, back in about '93, made this transition from being a journal that mostly was committed to publishing conference proceedings and symposia and monographs from NTP and other places. So the transition must have been a big one for the journal, to go to this place where it was going to become a kind of a regular journal with original contributions. And what did it take to start that process in such a way that it could lay the groundwork to becoming really the premier journal of the environmental health sciences?
Gary and I really spent some time together at that point in time when the decision was made that we were going to go ahead and have a journal that was more broad-based, to cover a lot of things, just beyond the monographs and conference proceedings, and to publish original research, to have a news section, to have stuff that in there and articles in there that were understandable to the general public. And we spent an awful lot of time working it out and going through what our plans were with the director at that time, Ken Olden, and he agreed with us in how we set the organization of it. And our goal was to publish the first issue, the broadened EHP on Earth Day in 1993, and we accomplished that. Gary also worked real hard to develop international connections with the journal to help reach underserved areas. And this was a long-term project. And, we eventually had a China edition and things like that, and reached several African countries as well. It involved translation and getting appropriate partners in those countries. And Gary did a fantastic job with that. The journal, as I said earlier, was I think fulfills an important part of the NIEHS mission, and that's the part of the mission that requires us to communicate in an understandable way to the general public what particular scientific findings were important, how they should be considered, and the journal helped fulfill that mission, I think, to a large extent. And the expanded version, of course, did that in a much better way than we did when we were just publishing conference proceedings. We had a great party, I know, on the Earth Day in '93 when we finally got it published on schedule. And I just remember that with fond memory, with all the folks that made it happen. That was a great time.
I mean, I remember seeing piles of papers on our secretary's desk to be mailed out to reviewers. Online submissions, which began, I say, around 2003, was a major improvement over those stacks of manuscripts and copies being made and distributed across the US primarily and around the world, when it would take weeks and weeks to review. So, we started out with paper and ended up electronic. I thought the news section was a great innovation because it reached a broader audience. We can talk to other scientists and medical staff, but environmental health really should be reaching out to more people. And I thought the science that was presented in the news section was a great contribution to that broader outreach. I really liked the idea this was multidisciplinary and it impacts everyone, and everyone should be involved. So I was very fortunate in 2001 to get the opportunity under, again, Dr. Olden, to expand to an international community. And so we introduced, we went over to Shanghai and talked to the Shanghai CDC and talked about doing a Chinese edition. And without Wei Hu, we wouldn't have gotten to it very far, but she's an excellent person and did a lot to get us started. So that was a big thing, was the international approach. Followed shortly thereafter with the African Journal Partnership Program through the National Library of Medicine and Fogarty International Center. Again, that was, if you talk about the things I really was happy to be involved with and proud to be involved with, the whole thing, but the international program, I think, was a big one. Again, we had this idea that there's more to research than what's being done more locally or in developed countries. Through the African Journal Partnership Program, some journals, including the one we were involved with, the Mali Medical, we were able to help them help themselves become a better journal. They had better papers, they had better presentation, and ultimately they made it into PubMed, which was a key to get their papers widely available.